Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Transitioning now to giving targeted therapies before surgery, what we call neoadjuvant. And I will say there is limited data for our more modern targeted therapies in this space, but we are seeing some early data from trials for osimertinib preceding surgery in EGFR mutated lung cancer. And this is somewhat of a complex table and perhaps made even more complex by the size on your screen. But a few key points here. Number one, there's a high percentage of imaging responses with lymph node response and actually downstaging of the tumor, which translates into a high rate of surgical resection and complete tumor removal. So what this indicates is osimertinib can effectively shrink tumors with high rates of complete surgery after giving osimertinib, at least in these early studies. However, when we look at pathologic response, we see something interesting. So MPR, that means major pathologic response, which means that when the surgeon goes to cut out the tumor, there's less than or equal to 10% tumor in the specimen that's been removed. PCR, pathologic complete response, means when the surgeon goes to cut out the tumor, there's actually under the microscope no tumor left after the treatment that was given. And you could see that these rates are quite low with osimertinib. And what that means, while these are small early studies, is that osimertinib alone is unlikely to fully eradicate and cure patients with resectable lung cancer, suggesting that surgery and perhaps additional adjuvant therapy is needed in this case. So there are ongoing phase 3 studies looking at perioperative, so before and after targeted therapy. This is the phase 3 Neoadjuvant trial, which is looking at patients with resectable stage 2 to 3B EGFR mutated lung cancer, randomizing 1:1:1 to chemo, or chemo plus osimertinib, or osimertinib alone, followed by surgery, and then optimal adjuvant, meaning medical therapies after surgery, including up to 3 years of osimertinib. This is a basket trial, or I should say umbrella trial, that includes multiple different cohorts of driver mutations with appropriate targeted therapy being administered before surgery, and then a similar design of adjuvant, meaning after surgery, medical therapy with targeted therapy included. And this is not all inclusive, but these are some other trials of RET, MET, KRAS that are designed similarly to be given both before and after surgery.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.